can I help you today?
Hi, I'm here for my albuterol inhaler refill.
What's your name and date of birth?
My name is Sue. My date of birth is January 1st, 1987.
Alright, and you're picking up your albuterol. What's the address?
1200 Elm Street, Manchester, New Hampshire.
Alright, here's your albuterol. Do you have any questions for the pharmacist?
Yes, I'm actually having a lot of trouble breathing right now. I was wondering if you could help me with that.
Alright, this is Tyler. He's our pharmacist. He'll answer all your questions.
Okay.
Hi, I'm Tyler.
Hi.
I'm the pharmacist here at MCE PHS Clinic. How can I help you?
I'm here for my breathing problem.
Okay.
I was just walking outside and I've been experiencing some asthma attacks. I'm using my inhaler, but it doesn't seem to be helping me very much. I'm still getting these attacks.
Okay. Why don't you come over here and have a seat and we can talk about this stuff. Okay, so it looks like you just picked up your prescription
Yep.
for your albuterol. Okay. So how do you take your albuterol?
I've been taking it just 2 puffs by mouth every 4 to 6 hours as needed for my breathing problems.
Okay, and what kind of breathing problems? You said you were having trouble breathing. Anything else?
I just run out of breath and I wheeze a lot.
Okay, and how often does this happen?
It happens pretty often. I would say I use my inhaler at least 4 times a week.
Okay. It looks like you brought in your peak flow meter too. Have you used that yet today?
Not yet today, but I used it before at my doctor's office, and he showed me how to set up my goal ranges, and he told me that when my flow falls in the yellow zone, that's when I should use my inhaler.
Okay, so why don't you do your peak flow meter right now? We'll just see where you are. Okay. All right. Now, Sue,
Yes.
do you think I could show you a few tips on taking your peak flow or using your peak flow meter?
Okay.
Okay. So, first of all, when you're going to do that, you want to sit or stand nice and straight, have your back nice and straight so you get your lungs all filled up. And then you're going to take, see this little red thing? This is the gauge that moves up and down when you blow in. So first, and one of the most important steps, is to push that all the way down to make sure it is on 0, so it's not up high. Because if you have it up high, then you might get a falsely high reading, and then you might not take your medication when you should, and that could hurt in the long run. So you want to make sure this is down below here, and then you're going to hold up the peak flow meter, kind of level with your mouth. Then you're going to take a nice deep breath in, and then you're going to put your mouth around the peak flow meter, and just kind of bite on the rim here, and then seal your lips around it. Just have a nice good seal there so all the air is going through there. And then when you have all that air in there and you have the good seal, you want to breathe out quickly and breathe out all the air in your lungs as fast as possible without making yourself cough. So something like this. Okay? So then when you take it away, the meter's going to have moved to wherever you blew in, or how much you blew in. Make sure you take it away kind of slowly and easily, not shake it around, because then you might move the meter to a false reading. So do you want to try this again and let's see where your reading is?
Okay.
Alright, that's much better. Okay, so it looks like you got into the yellow range. Now, like you said before, when you're in the yellow range, that means that it's probably time to use your rescue inhaler, or in this case, your albuterol. So if you're in the green range, then you're okay, and if you're in the red, then you probably want to go see, go to the emergency department, because that could be a sign of, very bad breathing. So given your symptoms of the shortness of breath, short breathing, and the wheezing, and the yellow mark you got on here, it might be good to take your inhaler right now. So could you show me how you take your inhaler?
Yep. So I just take this out, take the cap out. You just, close my mouth around the mouthpiece, and I quickly breathe into it, or breathe from it, as I'm pushing it down.
Okay, so it sounds like you're using your inhaler properly, but also sounds like you have had these symptoms quite often. You've had to use your inhaler quite a bit. Now, are you taking any other medications?
No, just my inhaler, and I've been taking it 2 puffs my mouth every 4 to 6 hours.
Okay, so it looks like we could, looks like you could benefit from having the addition of an extra inhaler. So this is good for a rescue inhaler, but it might be good to add a long-acting inhaler to help control your symptoms so you don't have these attacks so frequently. You don't have to use this inhaler as often. How does that sound for you?
That would be great, thank you.
Okay, since your doctor's right here at the clinic, I can go see her, and if you just want to hang tight, I can go see if I can get a prescription for you.
Okay, sounds great, thank you.
No problem. Knock, knock.
Hey, come here, Tiger.
Hi, so I was just down at the pharmacy with a mutual patient of ours, Sue,
Okay.
and she was picking up a refill for her albuterol inhaler. She said she was having some trouble breathing. So came in, it looks like she was having some trouble using her peak flow meter. So then when we finally got her doing that, she was in the yellow zone, and she said she's been having some shortness of breath and wheezing. And she says that this has been happening multiple times per week, and it's really bothering her. She has to keep taking her inhaler multiple times per week. And I thought it would be a good idea to come in today and suggest that we kind of do a step up for her therapy and maybe add on a low-dose inhaled corticosteroid to help control her symptoms, such as Flovin, 110 micrograms per puff. What are your thoughts on that?
Yeah, I think that's great.
Okay.
So why don't we add Flovin 110 microgram per puff, as you suggested? So Sue is now going to take 1 puff by mouth every 12 hours.
Okay.
And for now, we are going to give her 1 inhaler, and then she'll have 3 refills. So let's just try her with this and see how she does.
Okay.
Yeah.
All right. So I'll go down and start processing the Flovin 110 micrograms per puff. We'll do the 1 puff every 12 hours, and then I'll come up here and get your okay on the prescription, and hopefully this will help her symptoms.
Okay, that's fine.
All right. Thank you very much, doctor.
Okay, you take care.